So, have you ever found yourself maybe in the doctor's office or even just looking at your own medicine cabinet and felt, well, a bit overwhelmed? All those drug names, the jargon, the explanations, it can honestly feel like a whole secret language, can't it? Medicines are such a huge part of modern life, but how they actually work inside our bodies, that often stays a bit of a mystery. Well, today we want to pull back that curtain a little bit. We're doing a deep dive into clinical pharmacology. And let me just say, this isn't only for doctors or medical students, it's really for anyone like you who wants to get a clearer handle on how medicines really work. You know, from the moment you take them to what they're actually doing to your cells.
Yeah, and I think what's really essential to understand is that clinical pharmacology, it's like this critical bridge. It connects the pure science, how a drug works right down at the molecular level, with how we actually use it in patient care. Date, day to day, it's absolutely key for making sure treatments are not just effective, but just as importantly safe for you. It's about translating all that complex research into, well, predictable and safe outcomes.
Exactly, and that's why we're quite excited about this deep dive today. Our mission really is to cut through all that complexity. We want to pull out the most important bits of knowledge from the sources we've looked at to give you a clearer, more informed view on drugs. Like, kick off with some basic ideas and then build up to the more practical stuff. Think of it as your shortcut to really getting it. So let's jump in.
Okay, so if you've ever tried learning about drugs just by memorizing lists of names, well, you know how frustrating that is. It's almost impossible. But our sources, they really highlight a much smarter way to go about it, focusing on drug families instead. It's incredibly powerful. Instead of trying to remember every single anti-epileptic drug, for instance, or every opioid, if you understand the broader category, you often grasp their main uses and, crucially, their key side effects much faster. Because you see, most side effects actually come directly from the drug's main mechanism of action, how it's designed to work. So once you get how a whole family of drugs works, a lot of their effects become pretty predictable.
That makes total sense. Getting familiar with common drug suffixes, those little word endings, it's almost like having a secret decoder ring, isn't it? Can you tell us a bit about what endings like OLAL or S-statin signal? How does that help?
It really is like a decoder. Knowing those endings gives you such a head start. For example, COLOL, you're almost certainly looking at a beta blocker. That family is typically for high blood pressure, heart issues, that sort of thing. C-statins, that immediately signals a cholesterol-lowering drug. Then you've got OPRAL, which usually points to an ACE inhibitor, another common type for blood pressure. And EPAM, like diazepam, that tells you it's a benzodiazepine offered for anxiety or sleep. Understanding these helps you quickly slot a new drug into a category and, well, infer quite a lot about it.
Right.
The main exceptions, the things you often do just have to learn, are what we call idiosyncratic side effects. These are rare, unpredictable reactions. They don't follow the usual pattern for that drug family. It's like a machine suddenly glitching in a totally unexpected way for one specific person.
That glitching machine analogy really helps visualize it. Expert, that brings us to what you called their mechanisms of action. Yeah. What exactly does that involve precisely?
Mechanisms of action. We're basically looking at it on two levels. First, there's the cellular level. Yeah, this is about the very specific interaction, how the drug talks to certain cells. Maybe it latches onto a specific receptor, like a key and a lock. Or maybe it blocks an enzyme, stopping a chemical reaction. That tiny interaction, then those tiny cellular changes cause ripples. They lead to effects at the physiological level. That's how those small changes influence the body's larger systems, leading to the overall effect we see, like lower blood pressure or reduced inflammation. And our sources give a great example, amlodipine.
Yes, I saw that one.
Right. So at the cellular level, it's a calcium channel blocker. It stops calcium entering certain muscle cells and blood vessel walls. Simple enough, right? But the physiological effect, the result for your body, is that those blood vessels relax and widen, and that lowers blood pressure. It's a classic case. Microscopic action leading to a macroscopic body-wide benefit. Understanding both is really fundamental.
That definitely connects the dots from the tiny scale to the whole body. Great explanation. Now, thinking beyond just single drugs, let's widen the lens a bit to how doctors approach treating whole diseases. Our sources really stress understanding general therapeutic principles for conditions, not just isolated drug actions. Why is that broader view so important?
That's a really key point. It helps answer that common question. Why do doctors often prescribe several drugs for just one condition? If we look at the examples of the sources, it makes sense. Take heart failure. You often see a combination, right? Maybe an ACE inhibitor, a beta blocker, and a diuretic.
Right, I've seen that.
Each one targets a different part of the problem. One might ease the strain on the heart, another helps it pump better, a third reduces fluid buildup. They're working together like a team to manage something complex from multiple angles. Or think about asthma. Management isn't usually just one inhaler. You'll often have a bronchodilator for quick relief, an inhaled corticosteroid to control the underlying inflammation. Long-term, maybe newer drugs like montelukast targeting different pathways. Understanding these broader principles helps you grasp the why behind using multiple drugs. It's not random. It's a strategic, coordinated effort to tackle the different facets of the disease, which should lead to better outcomes for you.
That definitely illuminates the strategy behind it. Makes sense. Okay, so to really speak the language of drug science and understand these strategies, there are these two fundamental concepts, bedrock ideas, really expert. Our sources call them pharmacodynamics and pharmacokinetics. They sound like the two essential halves of the story for any drug. Can you walk us through them?
Yeah, absolutely. Fundamental pharmacodynamics and pharmacokinetics. Let's take pharmacodynamics first. Put simply, this is what the drug does to the body. Okay? It's about the effects. We look at things like efficacy, how well does it actually work, potency, how much of the drug do you need to get that effect, and whether it's an agonist activating something in the body or an antagonist blocking something. It's the drug's action plan, essentially.
Okay, what the drug does to the body. Got it.
Then the other side of the coin is pharmacokinetics. This is what the body does to the drug. This covers the drug's entire journey through your system. It starts with administration, how you take it orally for patch, then how quickly it gets absorbed into your bloodstream, how it gets distributed around the body, where does it go, and finally, very importantly, how it gets eliminated, usually broken down by the liver maybe, and then removed by the kidneys, the whole life cycle.
So one is the drug's action, the other is the body's reaction to the drug. It does sound like a bit of a dynamic relationship, and understanding both sides seems absolutely critical for a drug to work properly and safely.
Totally without understanding both, we'd be guessing. For example, someone's body might break down a drug super fast. That's pharmacokinetics. If so, it might never reach a high enough level to work properly. That relates to pharmacodynamics or it. If their body eliminates it too slowly, it could build up and become toxic. So understanding both lets doctors predict effects, figure out how long they'll last, and critically design the right dose for you, the individual. It ensures the medicine works well and safely.
All this knowledge isn't just academic, though. It clearly has very real-world consequences for, well, anyone taking or prescribing medicine. So, expert, what does this deeper understanding really mean when it comes to making smart decisions about health, ensuring quality care?
Well, this leads us straight into a really important concept called the quality use of medicines. This isn't just about popping a pill. It's about making deliberate, informed choices based on understanding. It involves carefully weighing a drug's benefits versus its potential harms, asking, what good does it do compared to the possible side effects?
The pros and cons.
Exactly, but it goes further. It requires a proper cost-benefit analysis, weighing the risks of the treatment itself against the risks of not treating the condition. Sometimes doing nothing or using something ineffective is actually riskier than the scientifically proven treatment. It's a really careful balance for each person.
And that careful evaluation, that informed decision-making, it sounds like it feeds directly into evidence-based medicine, or EBM. We hear that term a lot. What does it really mean in practice?
EBM is all about combining the best, most reliable evidence from research with the clinician's own expertise and considering the patient's values too. It's a very rigorous scientific method. It involves multiple phases of drug testing, starting in labs, moving to large human trials, all documented meticulously before a drug gets widely used. Think about it. Before EBM really took hold, a lot of medicine was based on tradition or maybe just what one doctor thought worked best. Anecdotes. EBM systematically asks, does this actually work and how strong is the proof? This focus on solid empirical evidence is just vital for public safety, for confirming effectiveness, and ultimately for getting the best health outcomes for you.
It moves us away from guesswork, right towards more certainty. Now here's where things often get, well, really interesting and sometimes quite debated, the comparison between traditional medicine and Western or conventional medicine. Our sources actually address this head-on.
Yes, they do, and they present a clear perspective on why Western medicine is generally seen as more reliably effective and safer. From that scientific viewpoint, it really boils down to a few key things. First, the purity of the active compound. In Western meds, you know exactly what the active ingredient is and how much. Precisely. Second, accurate dosage and concentration. You get the same amount each time, which means predictable effects. And third, crucially, knowledge of toxicity. We generally have a good understanding of potential harms, safe limits, and how to monitor for problems. These factors allow for much better control and predictability.
Okay, that makes sense from a scientific angle, but it's also true and important to acknowledge that many people do prefer traditional remedies. Often there's this belief, maybe unspoken, that if something is natural, it must inherently be safer. That's a common feeling, isn't it?
It is very common. And this is where a really crucial insight from our sources comes in something easily overlooked. They state, it is important to remember that all active substances can be dangerous if not used correctly. Whether a substance comes from a plant or a lab, if it does something in the body, if it's active, it inherently carries potential for both good and harm. Think about naturally occurring poisons. Lots of highly toxic things grow in nature. The label natural doesn't automatically mean safe or effective. And that's a really vital point. It highlights why the rigorous testing, the standardization, the dose control of conventional medicine is so important. It provides the clarity needed to use an active substance's benefits while managing its risks, whatever its origin.
Wow. Okay. What a journey we've been on today. We've really covered a lot of ground in this deep dive into clinical pharmacology, from, smarter ways to categorize drugs, deciphering names, understanding how they work from the cell outwards RA right through to the critical thinking behind using them safely and effectively. It's a lot, but really empowering stuff.
It absolutely is. And this knowledge, even though it seems complex at first glance, it really does empower all of us. Whether you're a patient trying to understand your own treatment or just someone curious about health, grasping these basic ideas helps you become a more active, informed participant in your own healthcare. You can ask better questions, understand the reasoning behind treatments, and, well, ultimately make more confident decisions.
Couldn't agree more. So here's a final thought, something provocative perhaps for you to mull over the next time you come across a new medication or maybe even hear about an ancient remedy. How might understanding these fundamental principles of clinical pharmacology, the mechanisms, the evidence, the risks, how might that change the questions you ask and the decisions you make? It's a powerful shift in perspective, isn't it? And we really hope this deep dive has given you some solid tools to start making that shift.